This is the Fearless Experience with Brendan P. Keegan. Conversations with leaders who provide valuable, candid insights from their journeys and share their secrets to what made them successful and fearless.
Today's fearless leader is Dr. David Rosenberg, a world-renowned reconstructive and facial plastic surgeon celebrated for his pioneering techniques and transformative results. But equally, beyond the operating room, he's an abstract artist at a world-class level. He blends his surgical precision with his artistic form. So Dr. David Rosenberg, thank you for joining us today and welcome to the Fearless Experience.
What a pleasure, Brendan. Thank you for having me.
Well, so one question I always love to ask when someone kind of picks like a profession where you're signing up to so much so early is, did you always know you wanted to be a doctor?
Wow. The idea of becoming a doctor, I think, emanated from an experience when I was 10 years old or so, and my father experienced loss of vision in one eye over a period of years from a corneal dystrophy. The cornea was degrading. And in those days, corneal transplants were just being developed, so they weren't mainstream. And we're a family of 6,
Wow.
worrying that this dentist might not be able to work. And the fear, the pain that he was going through, all that combined, it got under my skin. And he underwent a corneal transplant, one of the first in Manhattan. And it was something that was transformative for him. And so the idea of becoming a surgeon it was in the back of my mind. I didn't know I had the ability to achieve it, but it was something that piqued my interest for sure from an early age.
Where do you fall in line in the kids?
I'm number 2.
Number 2. Okay.
Yeah.
Any particular traits of number 2 that you believe in?
There's this belief in my mind that the first child has it hardest.
Okay.
That I use the analogy, if you're the first child, everything you're experiencing, you're the first one experiencing it. So for you, it's new. And it's kind of like being the snowplow in a blizzard. You've got to break through all of this resistance. And the second kid behind you has it easy. The second snowplow has much less work to do. So I think second child benefits from that.
My oldest daughter would agree with you. I guarantee you that she would say she had it harder. So you became a doctor, but then you didn't stop there. You decided you wanted to become a surgeon. You wanted to become a reconstructive and plastic surgeon. Now, what drove you to that specific discipline?
Thank you. So those are incremental decisions as well as
They
you
are.
go along. So I went to medical school. In the 4th year, which is your last year of medical school, you decide, I want to be a surgeon. And then within surgery, what field generally you want to choose. And I chose head and neck, ear, nose, throat surgery.
Okay.
And that field is 6 years of training. And within that period of time, you're getting exposed to cancer surgery, head and neck cancer. You're getting exposed to reconstruction of the head and neck cancer. And you're getting exposed to sinus surgery, ear surgery, meaning hearing surgery, all these different opportunities to be involved in the head and neck. They're all super specialized now. So if you're doing head and neck cancer surgery, you're not doing sinus surgery. Like, we get super specialized. And the area that I felt most excited about was the reconstructive component. And there was a small aesthetic part of that we are getting exposed to. So within that period of out of 6 years, by year 5, I decided I wanted to continue on as a facial plastic surgeon. And what that meant is aesthetic and reconstructive of the face. And that was additional training after that.
Okay, so I'm a math guy, but I think you'll ask me. So you got 12 years to graduate high school. How many years post high school of formal education? I know you do ongoing. Did you do what you do?
So it was pretty endless. So high school's done. You have 4 years of med school. I'm sorry, 4 years of college.
4 years of college, exactly, yeah.
Another 4 years of med school, so now you're at 8. And then I had 7 years of additional training, so that's 15.
Wow.
Yeah.
Yeah, so you're in your mid-30s, kind of when you're then like out practicing on your own, if you will, or in a
That's
practice.
right. I was 33 with debt, no reputation except for the people who knew me. I had my personal connections, but no professional reputation. And I put up a shingle.
So like, I love stories like this. So you're sitting there, you're 33, you mentioned the debt, you've got the debt, you don't have a reputation, you hang up a shingle, and now I'm not going to ask how many years later, you are at the top. You have climbed Mount Everest. You are considered the best of the best. You know, hey, heck, Kelly Ripa had you on her podcast talking about the best of the best. So, like, help people understand, like, what does it take from 33 to now? People that are 33 right now that are like, I'm inspired by Dr. Rosenberg. What does it take to become the best?
I don't always take time and think about this. This is something
That's all right.
I'm constantly moving. And I think that is part of what it takes to become what you're describing. You're constantly moving forward. And I think the thing that would be a defining characteristic of me as a surgeon and a person who runs a practice is that I get better every year. I keep getting better. So I don't stagnate. There's a lot of surgeons out there who have been doing this 25 years and they're doing the same operation that they learned and completed their training in 93, and they're still doing the same operation.
Yeah.
And my operation is so evolved even from 4 years ago in heading in directions of advancement. So I think of this as a small business, that every small business has a first day of business. And that was many years ago. And you put your roots down and you make people happy early on. And I think there's a couple of lucky breaks that come within these small business opportunities where someone comes in and they're happy and they happen to be a spreader of information. Yeah. And you get, in my mind, most people who have a relatively social life, I have observed they have about 7 people who show up to their practice. If you're a plastic surgeon, facial plastic surgeon, you open your shop alone or you join someone, there's probably 7 people who are going to trust you amongst family, people you've met on the street, whatever it is.
Okay.
And if you can make those 7 happy and share the information, I think you're set. And if you can keep making that work outstanding and more outstanding each year, you're going to grow. And that's what I think it took, was a constant improvement and seizing opportunities like those 7 people.
It kind of reminds me of two totally different things. Like, my favorite book of all time is The Tipping Point by Malcolm Gladwell. And in the book, he talks about connectors, people that like connecting others. So if you say, oh, I'm coming to New York, the first thing they say is, oh, you got to stay at this hotel. Oh, you got to eat at this restaurant. So getting some connectors in those first 7 people is helpful. But the second thing you said, I just think it's true agnostically across anyone who reaches the top. So I'm going to compare you to Tom Brady for a minute. Tom Brady, every offseason, he'd win an MVP. He'd go into the offseason, and the first thing he'd say is, I want to work on my short game. I got to get quicker feet. It's like, hey, bud, you just won the Super Bowl. You just got the MVP. Aren't you going to rest? And his answer was, no. The game's going to evolve next year. They're going to scheme to get me. They're going to scheme against our plays, and I have to come back better. And I think if you ask people that followed Tom Brady example, he was a better quarterback at 40 than he was at 25. Much better quarterback. But yet in his profession, he didn't have the physical skills at 40 that he had at 25. So, I look at what the way you answered that is, you're improving every year.
Yeah. And if you can improve 10%, 10% of where I am now is a lot more than 10% 20 years ago. The 10% of my abilities are much more evolved. So if I can keep getting better to a significant degree, that percentage is a large, you really can push forward. We've gotten better, not just surgically. I brought in a new associate who's a master surgeon and who joined me. And so I'm getting better because this team approach of I have another surgeon operating in the other room and we share ideas. And we just published a very important article in the premier plastic surgery journal in the world about our facelift technique and how we've evolved in the last 2 years. And for it to be accepted with video, describing what we do to every plastic surgeon in the world. And then people start to use that information to advance their approach. It's very rewarding. So we're getting better as surgeons, but also as communicators of what we do. And we're expanding what we offer because I have a surgeon who has amazing skills and he's going to be able to grow his practice under our roof. And if there's patients who are not able to use me for financial reasons, we have a whole nother group of patients who are using him then instead of losing that. So as a business, we're getting better as well.
No, that's great. It's interesting when you, because I look at the reconstruction you do, the plastic surgery you do, the art you do, and the transformation. I spent a lot of my career transforming companies, and I'd always say, after a few months when I'd be there, would build a business plan. And I'd tell everybody, save this business plan somewhere. Because in 4 or 5 years, you're going to look back at this. And by the way, when we built the business plan, everybody said, this is beautiful. This is the best business plan I've ever seen. But I would tell them, if we do our job right and we transform this company, in 4 or 5 years, we're going to look at this business plan and we aren't going to believe how much further we'd become as a business. And what's fun is every time we would wrap the company up after we sold it, I'd actually do that exercise. I'd take the team back. And so when you say 10% a year, 10% a year compounds. You do 10% a year for 5 years and it's 100% growth. So I just love that. I wouldn't have thought of that necessarily in your profession. But here's a question for you. So, I like talking about leadership a lot. And in your profession, like, how do you define medical leadership?
Medical leadership to me means mastering my craft and using that knowledge, and for us, it's technical ability to help patients and to help train surgeons to achieve a similar ability with their hands in mind so that they can go out and perform a similarly high level degree of care in a way that's consistent and shows perfect judgment.
Awesome. Yeah, because it's, because I think a lot of us look at certain professions as, you don't see them as big companies. You see them as, more small. I think you said it, small business, small boutiques. So, it's an interesting question. But now I actually want to get more interesting. I want to talk about the artistic side of you. So, you're a world-class abstract artist. From what I understand, these things take hundreds of hours. Am I correct in quoting you on?
Yeah. So they're layered. So I like doing large format, which I consider large format, which is 48 by 72. So that's 4 by 6 feet.
Okay. That's big. Yeah.
And the reason I like large format, it's hard to buy a stretch canvas larger than that, meaning I'm getting that framed or it's on the wood frame. When you get bigger than that, it's very difficult to find them and to ship them and to get them in the door of your apartment or house. So practically speaking, just about every one I've done is that 4 feet by 6 feet. And I go into it with a mood, with an idea like that. I want to think about springtime and think about the happiness that springtime in the New York area after a long winter brings. You walk on the street yesterday and the tulips are blooming and the air's not bitterly cold anymore. And there's an optimism. And so I'll go in this weekend and I'm going to start a painting or continue one that I started 2 weeks ago with that in mind. So that's color, motion, texture, and I put it down and I'm using relatively quick dry paint. So then in an hour or two, I can put another layer down and then let it rest. And then I might put that one aside and start another one and incrementally. So what you're seeing is many, many hours and months because I'm fortunate enough not to have a time schedule on these,
Sure.
where surgery is very, very time sensitive. Like we want to be to the 15-minute mark, and I certainly do. And so that pressure is not there with painting, but for me. And I've had people ask me to do gallery shows. People come through the office who are gallerists and in the art world, and I've turned it down because that feeling of pressure to perform again is takes away from what I'm enjoying in the painting. So I'm probably one day would say yes, but I'm not ready for that. So I just lay it down, and it takes time, and I have music going or an audiobook, and each painting kind of leaves me. I don't know where it's going to end up at all. I have no idea. Like, where a facelift's going to end. You have no idea. I have no idea where the painting's going to end.
So do you think your artistic side of you helps in your creative side in your medical profession, or vice versa? Like, do you think there's crossover there?
It's a use of the right brain, of that qualitative brain. It's when you're going through all this training, which we talked about, 15 years after high school, and even high school's hard, right? You're trying to get to college, like, you're working your left brain, you're working that mathematics and science brain and memorizing, and it hurts. That kind of learning hurts. At least it did for me. It's very meticulous, that learning that I went through for med school and residency. I didn't find that creative at all. And we always talk about that's left brain kind of work. And then as you learn how to operate really well and you do it again and again, it becomes relatively automatic. So you're not thinking, oh, put my finger there, put your hand there, cut here. It's flow. And that's then using your right brain. And that is that qualitative brain. And that's what this art is. It's that feeling of flow. And when I go and meet a woman or a man in new consult, and what am I trying to do? My goal in my business is to help the people feel great about their appearance in a way that is completely authentic to them, that is something that helps them feel attractive to themselves and comfortable in their skin, and that they can celebrate that they're, let's just say, 65, and they're thrilled that they wake up in the morning, look in the mirror, and look great. That's what I'm trying to do in a way that's still subtle and enduring. So I'm trying to be subtle, authentic, but have it last a decade. That's creative. To have that goal is creative. To tactically be able to do that in 4 hours in an operating room every single time is creative. It's the same now that I know how to do it so comfortably and efficiently and consistently. I find that art, when I'm painting, it's that same kind of feeling in there of flow and being creative. So there's some continuity in that. Definitely, I'm much more free painting than I am operating.
Sure. Well, you mentioned flow, and I remember seeing a documentary of a famous celebrity speaker, not celebrity speaker, celebrity singer. And I'm not the best on music, but her whole conversation was about, feeling the audience, getting in the flow of a concert. We've heard athletes talk about flow. And you just, as an artist, talked about getting in the flow. I think that was one of the common threads that you came across. But then you applied it to surgery, where instead of being more mechanical, you get into the flow of it. So that's pretty interesting. So I think I read somewhere that also in your abstract art, every once in a while in some of your collection, you'll repurpose items. Is that correct?
That is correct. So
what's that mean?
I think there's this kind of side to me, and it's interesting because if you think about what we're doing with facelifts, as an example, we are helping people enjoy themselves more from the past, meaning bringing their past selves back again. Does this make sense? Like,
yeah.
If your face is falling and you feel like you don't look like yourself anymore, there's a loss of self. And in repurposing, I'm taking old clothes that may have been in my life as a 2-year-old and bringing them back to the present again, because I'm putting them on a canvas with intermixed with abstract art. So bringing it front and center. So bringing things from the past back up to present. So it's in your life again. And I think when I was 9 years old, I was restoring antiques. That was what I did for a hobby.
Well, wow.
Literally would go into old barns. We grew up in an area that was old farming town, but 100 years earlier, and there were dilapidated barns in the woods because the place wasn't developed. And I'd find antique items and restore them. And I'd go find antique bottles underground, collecting antique bottles and clean them and restore them and put pottery back together. And I thought I was going to be an archaeologist at first. I'm fascinated with things from the past, I guess. And our faces, when I give a person who's coming in for a facelift, I'm giving their face from the past back to them in a way. In a way. So and I hadn't really thought about it in that regard, but there is that.
There is. No, it's interesting. There's so many connections in each of the things you talk about. So, as you sit kind of atop your profession and you have this desire to be better in 25 than you were in 24, like what motivates you? What's that inner thing that keeps you motivated to do that?
I think it's fun.
Well, that's a great answer.
I think fun is not to be minimized. The importance of having fun at what you do. I think that it's fun to operate well, and it's fun to be challenged by a hard case and to be challenged by a difficult person. Meaning a patient can be difficult, and to be able to navigate that interaction in a way that requires a lot of abilities, surgical, interpersonal, management of the office staff. It's a good challenge. So I think it's fun to keep improving. It's not fun for me to be mechanical and just book the surgery, do the surgery, next. That is not fun. And I need to have fun. I really mean that. So it's not fun like getting drunk. It's fun like
it's passion. Like something you're passionate about.
It's social because of the practice I built and the article that Dr. Timberlake and Dr. Paul wrote that just came out. We have visitors from around the world every week, from Brazil, from Germany, from around the US. We're meeting people. That's fun and sharing ideas. It's interesting because it's somewhat counterintuitive to share your technical secrets. Like Coca-Cola is not sharing their recipe, but in medicine, by and large, there's a dialogue of what is it you do and how do you do it, because it's not much different than watching a professional athlete. You can watch it, but you can't do it.
Yep.
And certain remarkable surgeons are going to be able to reproduce it. Maybe we don't let them in, but the idea is it's really social if you have this kind of practice, and that's fun. And it's really rewarding to see beautiful work come in. That's still really fun.
So you're at the top and you're as passionate today as you were, when you were 33, just starting out, you're having fun. What do you do to recharge? So you probably do some painting to recharge, but like, what do you like? Do you any hobbies, any things you like to get out in the world and do? Tell us a little bit about you out of the office.
All right. Well, one thing, I'm much less scared than I used to be. When you're starting a practice, you can't sleep. It's all you think about is any business.
I was just going to say I think you're talking to every entrepreneur out there.
And while you look back on that and it's so exciting, it's also, you could fail. It's petrifying. And so you have a $1 million mortgage on a $700,000 house, like you're sweating. So there wasn't, I don't have that feeling anymore. So now I'm able to take time, and the things I do besides paint, I have 3 children, and my son, who's now 19, and I are avid fishermen. So we have a home in Long Island, and we're starting mid-May, the striped bass come in. Yeah. And then lately the tuna have been coming through Long Island more than ever because there's more bait. So we've been successful at catching tuna. I love golf. I am not great, but I spend time doing that, and I belong to some golf clubs. I love Italy. So I'm in particularly Umbria, and I have surgeon friends in Umbria. So I'm over there at least, I would hope, twice a year.
Okay.
Yes, I am a cook, and I've been a skier, but we gave it up this past 2 years because we thought the risk reward wasn't there anymore.
So you said you have 3 kids. You have a 19-year-old son. What are the ages and genders of the other 2?
My 19-year-old son's a college freshman.
Okay.
I have a 23-year-old daughter and a 26-year-old daughter.
Oh, great.
And my wife's a surgeon. She's an eye plastic surgeon. And she's a musician, a singer-songwriter under the name JELA, Jela.
Okay.
And they're quite successful in her own right. It's like we actually kind of try to foster creativity in the house. She's constantly doing her music. She does more music than I do painting.
I should have done this as a dual podcast and got her on air with you. So is it JELA?
JELA, and it's on Spotify, hundreds and hundreds of songs.
Okay.
I think she's hit her 20 millionth stream.
Oh, wow. So listeners out there, hit up JELA and get her up to 25 million now. That's impressive. Did you ever, how did one surgeon marry another surgeon?
Okay, so we were talking about our training, so we're going to get into some specifics. First part of surgical training is general surgery.
Yep.
General surgery is trauma, it's hernias, it's colon cancer, breast surgery. It's general, it's everything.
Yep.
It's hard. After med school, if you want to go into head and neck surgery, back then you had to do 2 years of general surgery. So I did those 2 years in Manhattan. And at the end of that second year, that's when head and neck surgery started. And so then you had 4 more years of just head and neck surgery. And it was rotations, 4 months, 4 3-month rotations per year at Sloan Kettering, which was cancer surgery, Cornell, which was everything, cancer, reconstructive, Jamaica, which is brutal trauma, and Lenox Hill, which was bread and butter ENT. My first day was at Manhattan Eye and Ear, which was also bread and butter ENT, and we had a lecture hall meeting of all the new doctors. And JELA, Jessica Latman, was sitting in front, and she looked pretty. So
There we go.
and that's actually true. And I said hi, and then the next day I went over to Sloan Kettering for 3 months. And so that 3 months you're lost. You don't leave the hospital. And then I went back on rotation, and then we got to know each other.
So every 3 months you got to say hi. You got to kind of have a first date over again.
It was like that. Yeah, it was like that.
Oh,
Just
wow.
when you get to know each other, they send you off again. Yeah, and that went on for 4 years. So that was 4 years after 2. It seemed endless.
Then what brought it together?
At the time, I had been involved with other women, and I was bored because I always felt like I was the one leading. I wanted someone to push me. I thought I wanted it. So anyway, she's a triathlete at the time and was winning her age groups, getting up at 5, doing these races. And like, this is cool. So it was very enticing. And we'd be post-call and out in Central Park going on these roadrunner races. I thought it was kind of fun. It's like this girl was interesting to me, plus a surgeon. But she wasn't that interested in me. All right. I could tell. And so she was losing interest. And I was post-call and at the hospital called Manhattan Eye and Ear, the place we met. And the way call worked is you would work Friday night, Saturday night, Sunday night. You wouldn't leave the hospital except for Sunday morning. You got 3 hours to shower and whatever. This was back then. You can't do that. That's not legal anymore. All right. So I had 3 hours. I called her up. I said, do you want to go for a run? Because I knew it was this or she's going to dump me. She's like, fine. So we're running through Central Park, and it's a 6-mile loop. I don't know if you know Central Park, but in Harlem, there's a big uphill, steep.
Yep.
She takes off in front of me. And I knew if she beat me up that hill, the relationship was over. So, because she was pretty competitive. So I'm like, all right, I'm going to go for it. And I beat her up the top of the hill. And that was it. I'm not
That was
kidding.
it. So that was the day she liked you, when you were able to keep up with her.
She's mellowed out a lot, thank God. But that was the reality then. Yep.
Ah, that's great. That's great. If you were to flip this now to you kind of, later in your career, looking back at young people, what advice would you give to them? What advice would you give to a 22-year-old? What advice to your 26, 23, and 19-year-old? I'm sure you've given your own kids advice, but if people are listening out there and they're struggling or they're doing well, either way, what advice would you give to them?
Start with turn off your phone an hour a day and maybe take a walk, get outside, get some time away from technology and just have some quiet time inside the head. Because we had a lot of that. We had time to think and be bored. And I think boredom's wonderful. It's time to think about what else you can do and not be crowded with that technology that we're so encumbered with now. And I think that to be gentle to yourself, I think that there's going to be periods where you're going to struggle. And if you understand, like if you're a hard charging person and you're in a rut, try to be gentle with yourself and to not think that rut necessarily is permanent. We all get into hard periods. And I let my kids know, like, listen, if you're in a hard job, you're unhappy where you're working, give it some time, because work can be frustrating. But if it's consistently unpleasant for you to the degree that you're not mentally well for a protracted period of time, it's time to make an effective search for a change. And I think that more than ever, I think that the younger generation's making changes in their career paths. They're not staying with IBM their whole careers. And I think some of that is their sensitivity to wanting to have the rewards earlier on. And if they're unhappy, they're going to move on. But I think that there's something that's not in my house, if my kids are unhappy for a year in their work, and listen, if you're in a residency for 7 years, like we were, or I was, and other people going through it with me, you have this fantastic goal at the end that made it worth it. So it's not quite transferable to someone who's working in middle management somewhere. So I think that for people like young people who are entering a career, it's to have this vision of like, maybe it's so hard to translate it to the global population, but to have, like, I always say, what's your 5-year goal? What's your 5-year goal? And to see if you can have some sense of that and to have a path in that direction.
What advice would you give then to young doctors, or people that wanted to go into the medical profession? So we talked about the population at large, but now we've got somebody at Manhattan Eye and Ear, and they're at their first year of residency, and maybe it's not going well, maybe it is. What advice would you give to young medical professionals or medical want-to-be professionals?
So I think of medicine as surgical and non-surgical. So non-surgical would be internal medicine, endocrinology, anything that is not using your fingers. Does that make sense?
Yeah, that makes sense. Yeah.
So much thinking going on. Getting that information is, to me, in a lot of ways, about getting the right teachers, also the right books, the right classes, the right exposure. And I think anyone who's going into that just needs to seek out where's the best places to learn information. And then it becomes algorithmic in my mind. A person presents and their blood pressure is high. Class 1 drug is going to be a beta blocker. It's just algorithm. Does this make sense? The next person comes in, They have high blood pressure. They never had it before. You give a beta block. Learning to use your hands, learning to use your fingers, your eyes, your mind on a person's flesh. I think the advice is you got to find the best people on earth to show you how to do it, and have them not only watch them, but have them hold your hand and find apprenticeships. I'm a huge believer in apprenticeship. I think that the idea of masterful surgeons, whether it's an orthopedic surgeon, an ophthalmologic surgeon, someone has held their hands early in their career and helped them learn that. And I'd give them that advice. And I mean, I think surgery, being a great surgeon and personally and being in aesthetics is such a wonderful, rewarding career in every way. So if someone's thinking about going into surgery, I think if they're the right person, I would say you might want to consider this if you're entrepreneurial, because in most of medicine is no longer entrepreneurial. Most of medicine now is joining groups, joining hospital systems, joining insurance systems where you become an employee of a large company. So the entrepreneurial spirit of medicine has changed a lot or dissipated.
All right. Well, that's some great advice there. So, apprenticeships, mentors, people in your case, literally to hold your hand. For other people, it might not be holding your hand, but in your profession, it is holding your hand. Just tremendous advice there. So, Dr. Rosenberg, thank you for being on the Fearless Experience today. To our audience, I think we learned a lot today. We had the best of the best reconstructive facial plastic surgeon, abstract artist, and husband of a celebrity singer. That might have been some of the highlight in there. Remember, look, JELA up on Spotify, and let's see if we can get her to 25 million. Dr. Rosenberg, it's just been a pleasure. Just kind of listening. I think from your tone, I can feel the care, the simplicity, the authenticity come through, and I know our audience will. So thank you for being a part of the Fearless Experience today.
Thank you for including me. Amazing.
This has been the Fearless Experience with Brendan P. Keegan. If you want to learn to live and lead fearlessly, go to brendanpkeegan.com.